May is Mental Health Awareness Month, and according to the National Center for Health Statistics, women 40 and over have continued to maintain the highest rates of depression, with 1 in 5 women 40 to 59 years of age on antidepressants. Unfortunately, that pace has been exacerbated over the past 2 years. Psychologist and mental health expert Garcia-Balis has experienced this uptick firsthand as the CEO at Airport Marina Counseling Service. She joins us for her take on what's causing this rapid rise in severe depression in middle-aged women. Welcome. Thank you so much for joining us this morning.
Thank you, Giselle. Yes, it's very, very serious. For many, many years, for decades actually, middle-aged women have had the highest rates of antidepressant use. As you mentioned, 1 in 5 women are on antidepressants in the country, and women during menopause are 2 to 3 times more likely to experience a depressive episode, which is very, very high.
So, let me ask you this question. Are we seeing a rapid rise in middle-aged women suffering from depression, or are we just recording that data differently these days?
We are recording the data differently these days, as women tend to seek mental health services more than men. Therefore, we have more statistics on women, and women are getting more treatment.
So what are the top reasons why women face depression, let's say, more than any other demographic in this age group? Presumably, you're of childbearing age, you've had a career. In some cases, your children may have left the home. What are the compounding reasons that women, particularly of this age group, are so afflicted?
That's exactly the reasons, Giselle. It is that women are juggling many, many things during midlife. They may be raising or launching children. They may have their career that they're dealing with. They may be also taking care of elderly parents. And then on top of that, they're experiencing these changes in their body, all of these internal changes that they can't control, which can be very, very scary. On top of that, many women report that they experience external changes as well, changes in their hair, changes in their skin, changes in their nails, and they don't know what to do about it.
Right. And for such a long time, there was a stigma for women, just care for your children, care for your household, everything external. And it was there was a shame or a stigma attached to admitting any kind of need for mental health help. Does that stigma is that still relevant today for many women?
So there have been strides, and there has definitely been a movement to destigmatize mental health. And I've definitely seen that we have made some headway here, but there is still much, much stigma around women and just people in general receiving mental health services. And that really needs to change.
Well, some women rely heavily on antidepressants, but there is also some shame attached to that as well. Talk to us about the top treatments for depression, particularly for women in this age group, 40 to 59, and if antidepressants are the best answer in some cases.
Sure. Yes. So in some cases, antidepressants are the best answer. Women in midlife, I think it's really important to talk to your medical provider. Is it that is there hormones at play and you're a better candidate for hormone replacement therapy? Or is antidepressants the best way to go for you? Another alternative is mental health treatment. So is it better to actually seek a mental health professional and talk things through and figure out better coping skills? Most medical insurances do have a mental health component. But if there isn't, there are organizations like the one that I work with, Airport Marina Counseling, that provide services at low cost. And the fee is based on a sliding fee scale so that anyone can afford the services.
And what else can be done to combat depression? Are you encouraging women to, kind of delve into yoga or music or the arts to lift the spirits? Because sometimes that's also an alternative to medication, right?
Right. That is exactly right. And all of those are great alternatives. There's also daily exercise that is very, very important. There's great meditation apps out there. So I encourage folks to research those too, but definitely not going through this alone. talking to a friend, figuring out things that excite you and motivate you and make you happy, and doing more of those things.
Yeah, and can you talk about just quickly what other free resources are available to those in need in the LA area?
Sure. So there are groups available for individuals that are either dealing with depression, anxiety, or a variety of other things. The meditation apps that I talked about, some are free, others you do have to pay for. I would encourage you to go online and do some research and see what's out there. There are organizations like mine that do offer some free groups and some free services, some time limited, but any kind of service, any kind of, really, really helps.
Eden Garcia-Balis, you're doing such important work at Airport Marina Counseling Service. Thank you so much. We have to destigmatize, take the shame out of women coming forward and saying, hey, I'm battling depression, I need some support and help. So thank you for the valuable and vital voice that you provide on this issue.
Thank you, Giselle. Good to
Thank
meet
you. Have a great Tuesday, and we'll be back, everyone. This is your morning on Spectrum News 1.